Okay, thank you everybody for coming. It's great to see such a full room. We actually have quite a few seats left up here, so if you're coming in, feel free to filter in here. I hope that everybody got some pizza. We also have some seats over here, it looks like, so come on over. Okay, we'd like to thank everybody for coming today. We're really excited about this panel that we have today. And we have a great lineup of people who are here to talk to you about issues relating to deaf persons in healthcare and how we can better serve the community. I know that a lot of you are healthcare students or healthcare professionals or teachers. So okay, let me introduce myself first. So my name is Sarah Hall, and I am a professor in the Department of Public and Community Health. And I got interested in this because I was assigned to teach a diversity class. And in my diversity class, we do student presentations, and one of the students last year decided to do a presentation on deaf culture because she was familiar with deaf culture. And I thought to myself when I saw this presentation, I don't know anything at all about deaf culture, and I need to learn about it. And so I ended up having a speaker come into my class the next summer, and then the next semester, and then I met Dr. Michael Ballard, who is over in ASL and Deaf Studies, and we've been collaborating on a couple of different things. Oh, thanks. So we've been collaborating on a couple different things. Can you guys hear me back there? Okay, and that's how I became interested in deaf culture and how to better serve deaf persons in healthcare. I enrolled in an ASL class, just 101. I'm not very good yet, so I don't know a lot, but I'm trying to learn. So I want to go ahead and introduce our presenters. So the first is Jared Albus. So this is him right here. And I'll just tell you a little bit about each of them. So Jared Albus is the founder of Albus Law Group. He attended Brigham Young University and graduated with a BA in English. He attended law school at Thomas Jefferson School of Law in San Diego, California. He graduated in 2009 with a JD and moved to Utah to practice law. In 2011, he opened the Albus Law Group and began representing both hearing and deaf clients. He specializes in the following areas of law: advocacy, estate planning, business law, discrimination law, and deaf rights. He is licensed to practice law in Utah, California, and Arizona. He also sits as a community representative on the advisory council to the Utah Division of Services to the Deaf and Hard of Hearing, the USDB Advisory Council. So thank you for coming, Jared. Okay, and next we have Dr. Michael Ballard.
You're welcome.
This is Dr. Michael Ballard right here.
Hello.
And he has a PhD, and he's an assistant professor in the Department of Languages and Cultures at UVU. He earned his PhD in education from Drake University. Additionally, he holds degrees in communication and leadership from the University of Colorado and Gonzaga University. His research interests include healthy identity formation, deaf role models in education, and navigating deaf-hearing cultural conflicts. In addition to classroom settings, Michael enjoys cultural workshops and consultations. When not working in the academy, Michael enjoys spending time with his family, outdoor cooking, and bonfires. We're going to skip over to Dan Mathis, who's right here. So,
Hello.
Dan grew up in the Salt Lake City area, and he never became deaf. In fact, he already has been deaf since the beginning of his DNA molecular development. He is a native ASL signer and fluent in both ASL and English. He graduated from Gallaudet University with a double BA in ASL and Deaf Studies and also an MA in Sign Language Education. He's currently a lecturer in the ASL Deaf Studies program at UVU, and he has a wealth of experience in the education of ASL Deaf Studies and interpreting in a variety of settings from K-12 to higher education. He has lifetime experience dealing with challenges and issues with interpreting and accessibility in all aspects of life, including healthcare. And on the personal side, his family consists of his wife, Stephanie, and 4 grown teenagers and young adults, and canine and feline pets. So over here we have Janelle Nielsen. So Janelle, LMT, is a licensed massage therapist with Cradle Your Soul. She graduated from Cortiva Institute for Massage Therapy. She earned a Family Life Science BS from Brigham Young University. She started the Utah Deaf Hospital Rights Movement, having successfully completed the first protest at the Utah State Capitol. She loves to spend time with her husband and son dancing, painting, and exploring the city. And over here we have Mackenzie Smith. Mackenzie Smith is a CNA from, I'm not going to say this correctly, Jean Massal School for the Deaf. She earned her certification through Salt Lake Community College.
JMS.
JMS, okay. She earned her certification through Salt Lake Community College, or SLIC, Mackenzie is also a deaf mentor for the Parent Infant Program, or PIP. She enjoys working with kids and families. When not working, Mackenzie loves to spend quality time with family, friends, and dogs. And dogs was all in caps, so I think she really likes dogs. Also enjoys cooking, game nights, and camping. And then lastly, we have Kim Coleman, and I'll let her introduce herself because she's kind of a new addition to the panel.
Thank you, I just got added. I'm Representative Kim Coleman. My connection to the deaf community is my husband is Superintendent Joel Coleman of USDB, and my niece is Leah and Rachel Coleman. So I work with Representative Norm Thurston, who's a great friend to deaf and hard of hearing issues, and so we collaborate a lot. And the last 2 years we've been working with Jared to try to get the international airport to provide looping and other kinds of improved access. So I'm on the policy side of things and always listening for what we need in this world.
Great, thank you so much for joining us today. Can we just have a round of applause for all of the presenters that are here today? Thank you. Okay, sorry, I'm going to come back here. Sorry, it's a little bit tight in here. Okay, so we're going to talk a little bit today about cultural competency, also about community health, healthcare administration issues with deaf culture and better serving deaf persons, and then just see kind of what the takeaway is. And we have Rachel Lund here who's going to be passing out some papers, so if you come up with any questions during the panel, please write them down and then we'll collect them and we can have them answer your questions during our Q&A at the end. So I've collected some questions from students and then plus a few additional questions. So I'm just going to go ahead and start asking some questions and we'll see where this goes. We don't know exactly where it's going to go, but I'm going to start with they could kind of be categorized into a couple different categories. Some were cultural competency, some were community health, some were healthcare administration, and then just kind of other random questions that we had. So we'll start with the cultural competency questions. So first question. So to begin, on October 26th, there was a protest held at the Utah Capitol. Can you tell us what sparked the protest and what the protest was hoping to accomplish?
I guess I can answer that. How it started, honestly, was through Jared. And last August we had a meeting and I went to it and we talked about the problems with hospitals and interpreters. I had two experiences this year, a planned emergency and an actual emergency. No interpreters were provided. My life on the second one was in danger. There was no live interpreter provided. I was struggling with the VRI, the video remote interpreting. VRI is the acronym. And the time lag, and my life was in danger. I almost died. If I had a live interpreter, if it was provided to me, I would have been okay. I am now okay. It was close. It was very scary. I was very angry. I went to the meeting and I heard more and more stories like mine. And I looked at Jared and said, how do we stop this? How do we change this? And he said, protest. Okay. So we did the protest. And that's how we started.
Anybody want to add anything?
I'll add something, and that is sometimes the best thing to get changed is through legal issues.
Jay.
Oh, it's on. Oh, there we go. So, alrighty then. So, change comes about in a lot of different ways. One way is through litigation, where you file a lawsuit, and then after some back and forth, both parties come together and say, okay, let's fix this, or how do we resolve this? Another way of change is through advocacy. You have lobbyists, you have organizational meetings trying to make things change. You can also do it legislatively. But sometimes the most effective way is doing a protest. And I think the deaf community, I think it's fair to say that the deaf community has reached up to here. They had enough with not getting the accommodations that they needed, and the time was right for a protest. And so when Janelle said, "Hey, I want to do something. What do we do?" Protest, and she ran with it, and she did a great job.
Like Jared said, I always want people to understand the power of one voice. The power of lots of voices is even better, but the power of one voice. As a policymaker, as a state lawmaker, even one voice has been able to help me understand an issue better, help to understand how people are impacted. As a hearing person, I am still kind of learning. When we talk about cultural competency, I just had this discussion just a couple nights ago with my husband, that too frequently people think that, now how about I don't get this wrong, interpreting is not the same as translating, and I'm just starting to understand that. So frequently in the among hearing policymakers, they don't understand that difference, and so they think it's just kind of okay to have things written down on pieces of paper, things like this. I'm learning how very, very different that is. We need to be educated as policymakers, and sometimes gathering together on the steps of a Capitol and making noise makes us stop to listen. But please call your representative, email your representative, and educate them. Cultural competency has to start with educating policymakers on what it is that you need. And one voice can make a big, big difference. And please understand that your one voice can make a big difference.
Can you guys hear me? Okay, yeah. Okay, we have some chairs up here. You guys can come on in. Don't be shy. There's about 3 over here, 3 over there. Come in. Oh yeah, and can you guys scoot toward the edge so that more people can come sit in the middle chairs?
And if nobody offers you a seat, I'll sit it for you.
Come on in, guys. Okay. So the second question. So that you hear a lot of terms. Come in.
Don't be shy.
We're making space. Everybody is welcome. Thanks. Okay. So we hear a lot of terms like deaf, hard of hearing, and hearing impaired. The question is, which do you prefer, and what are the differences between these terms?
That's not my thing, that's your thing. Michael? I don't need this. It's a great question, actually. Deaf, hearing impaired, hard of hearing, these are all terms. They're words. And we try to be politically correct. We try to appease the general audience and not offend. But you have to remember, terms are made by a community, and you should refer to what the community and what they've empowered themselves and what terms they've created for themselves. Within our community, we create our own names and our own terms, and that's okay. So words or terms like hearing impaired was not created by the deaf community. It was created by hearing people who were trying not to offend deaf people. But you have to understand that that term in the deaf community is unacceptable. Now, there's always, in your work, you're going to bump into people who have different experiences, which means that they may have certain terms, and that's up to them, what they refer to themselves as. So you should allow them to refer to what they prefer. and you say, so do you want me to call you, refer you as deaf or hard of hearing, or how do you identify? I want that to be up to you. So let them self-identify. That's one aspect of it. Hearing impaired, to most of the deaf community, is quite offensive because it's telling us what we can't do. That there's something you can't do. It's a negative connotation. We just call it what it is. We're deaf. We can't hear. We can't hear. So it's not... It's nothing to be ashamed about. The term deaf is not a dirty word. So how we deal with people is by respecting their choices, and that people have those choices. And if we label them as hearing impaired, then it's like, oh, well, this person, they can't hear, they're hearing impaired. That's not the language we use. So it's important to be cognizant of that and to ask the individual. It doesn't hurt to ask how they identify.
I think it's important that you understand that we can't hear, we can't communicate with the people who hear fluently, but you know, each deaf person has their own journey of acceptance and accepting a disability. We know that there is a problem, our ears don't work, but we don't wake up in the morning and go, oh, I have a disability, I am hearing impaired or whatever. We know who we are. If you don't know who we are, we do, ask us. We're not going to be a hypocrite, you know. Don't ignore our hearing problem, okay? We just identify it. Yeah, you're deaf, you're cool. You're hard of hearing, you're cool. Okay, also I want to mention on my journey, I was hard of hearing for a while, and then I became deaf. If you've seen me for a while and you said I was hard of hearing and then I changed my identity, that can hurt too, okay? Does that make it clear? So just always ask. It's never offensive if you ask. I'd like to add to that. So I grew up oral. I had a deaf mentor, many families, and that I'm a deaf mentor to many families. People assume I am hard of hearing. I am not. I am deaf. I can speak well, but I do not hear. My hearing aid taken off, I cannot hear. My hearing aid is just that, an aid. I identify as deaf. And so it hurts, like people say, you know, they decide for me because they see a hearing aid that I am hard of hearing. So and this is my perspective, and many people think that people who are hard of hearing have almost normal hearing. We don't. That I am deaf, I am trying to hear something. So it's best not to just assign something to us, even if we can speak well, okay?
Thank you. Yeah, I can relate. And I want to keep an open perspective because quite often we assume that deaf means that everybody signs. Not all deaf people use sign language. It's based on their experience, their upbringing, and there's a lot of subcultures. People do call themselves hearing impaired, hard of hearing, late deafened. In fact, the largest percent of deaf people are late deafened, where they become deaf later on in life. Their hearing goes down, and they may be involved in war. They may be working in a loud environment. Their genetics, you know, people lose their sight over time. They also lose their hearing over time. So there's definitely a big range of hearing ability. Just like me, I was born completely deaf. Well, but how did you become deaf? Well, I was born deaf. Well, how did you lose your hearing? I never had hearing to lose in the first place. It was in my DNA. I mean, I was born deaf. To the bone. To the core. So just keep that in mind, that there are different groups, subcultures within the culture. And, you know, some deaf people say, I'm hearing impaired. And I say, oh, you call yourself hearing impaired? Well, yeah, because I can't hear. Well, that's okay, because that's the way they were educated. That's the way they've socialized. And, you know, there's really two perspectives to the term deaf. There's the audiological perspective, a medical perspective, and then a cultural perspective. I consider myself capital D deaf. And then the lowercase d deaf is just referring to your hearing ability. And so that's where it varies within the deaf community. How do you call yourself deaf? It's not dead. It's not death. You know, sometimes you have the spell check and it says deaf, but it goes to death. No, we are deaf with an F, right? It's not the same. You know, it's like, oh, you're deaf, you're sick. It's like the Black Plague. You're all decrepit and you're gonna die. No, just keep that in mind. Yeah, I would like to add to that. Thank you, Joy, Janelle. This term, deaf, it's not dirty. It's just a term. The idea of disability comes from what? I mean, disability, I view myself, I don't know about everybody else, but I believe that it's a social construct, which means it's something that we've created, we've constructed this, and if I don't have access to something, do I call myself disabled? But because of the social construct, it's not because I'm disabled, it's because I have no access to that system which has been set up. The system itself may be flawed, and it's frustrating for me, and it calls me disabled, but I'm really not disabled. So disabled is a social construct, and I'll give you an example. Let's say that you are able to go to a place where all deaf people are associating. What's the accommodation? Everybody's signing, and nobody can speak, so who's disabled? It's not the deaf people, it's the hearing person who joins that group. So that's a similar perspective to where we feel, does it really mean that they're disabled? What does it mean to be disabled? Not deaf, or not death, but deaf, right? There's a variety of perspectives, and once you realize that perspective, now you can see it from a different angle. You can see it and build from there. Now, who are the builders of that worldview? And how do we build that worldview? What and how we access builds our worldview. And that might help you support each other as humans, right? As a human family. Thank you.
So much for those responses. Okay, here is the next student question. It says, when I was 18, a woman came into my work and my boss told me she was deaf. I kind of froze because I didn't know how to communicate or what to do. So I just started writing on a piece of paper, but I didn't know if that was okay. What should I do in that situation? If you don't know ASL, how do you interact with someone who is deaf?
So I always say, if you don't know how to sign, don't try. Because I'm looking at it, my time is valuable. So if you have plenty of time, you can say, oh, my name is such and such. But if it's important, the best recommendation is start with pen and paper, you know. If it's an appointment, of course, try to get an interpreter. But phone text, making sure that the person you're trying to communicate with understands. Because they might not understand English. If they grew up with ASL and signing is their first language, they won't have a command possibly of the English language. So maybe write with gestures. If you don't know signs, you know, people say, oh, you're deaf, but their gestures were way off, and it was really wasting my time, and I
I was in a rush and I don't want to teach them how to sign, so pen and paper was best for me.
Right, so the student had never met a deaf person and they were kind of dumbfounded. How do I connect with this deaf person? It is nice to have something in mind to prepare yourself. Maybe you can sign a little bit, maybe they are oral. Maybe they came from another country, they may be an immigrant. So try gesturing, give them options. Give them an opportunity to decide for themselves. In writing, in text, lip reading, and let them decide. Sometimes it's like, oh, you're deaf, I know sign. And then they struggle and they're like, wait, this is easier for me. So it's very important to, especially if it's an in-depth discussion, we're gonna hold back because we're afraid of misunderstandings. You know, here's a big paragraph. And if it's just to make an appointment, that's no big deal. But all of a sudden we're going to become a deer in headlights, and quite often I'll meet somebody and I start signing and they're like, whoa, wait up. You know, if you go to Wendy's and they have different number combos, it's like, I want a number 2, and they're like, whoa, he's signing to me, he's using his fingers. Are you looking at me? No, look at me. The number 2 up there. Oh, I don't know what to do. Right? So it's nice to have some kind of handle on what you can do and have somebody that can deal with that. You know, people communicate in different ways.
But it's okay if you are the deer in the headlights, you know? We're used to it. We love you, you're fine. We don't like you to take charge of our lives, though. It's okay to be a deer in the headlights and, you know, hand us a paper and pen. It's not the end of the world. And adding on to what you had to say, if you say, you're deaf, just a minute, let me get somebody else to talk to you because I can't handle it, because we can read your body language, you know, you might be contaminated or something. If you're struggling, just say, hold on, let me get somebody to help me understand. That's not going to help us, okay?
One thing I'd like to add is sometimes I'll be like, can you understand what I'm saying? Let me talk louder for you and move my lips more so you understand. That doesn't go over well either. So if you see somebody who's hard of hearing, speak to them normally, and if they're not getting it, offer another solution for communication. Just because I can wear hearing aids and I can speak and talk doesn't mean that you need to project louder or have wider vocalizations. So kind of just gauge and figure out where they're at, but speaking like, hey, my name is Tom, it just doesn't work. So that's what I would add from somebody who, I consider myself culturally deaf, but I also speak very well. But it is kind of offensive to have somebody over-exaggerate their speech or their mode of talking.
Thank you. Okay, we had a few questions about how to interact with a deaf person and an interpreter when an interpreter is present. So some of the questions were, who do you look at when you interact with a person who is deaf, the interpreter or the person? What's the protocol with interacting with the interpreter? Can you greet and chat with the interpreter, or are they just there to interpret?
Ignore the interpreter. It's as simple as that. They are there to help you communicate with the deaf person. Look at the deaf person. The best way to de-edify a deaf person is to ignore them. You know, talking to the interpreter and you're speaking to the deaf person is inappropriate. You know, just like now, I can hear the interpreter and I'm trying not to look at the interpreter, but I'm looking at you because she's speaking. The quickest answer is ignore the interpreter. They're not there to be involved with the situation. They're there to make sure that the person is involved in the communication.
Thank you. That's a great question, actually. Deaf people are humans too. We have feelings. We have relationships. We have thoughts. We have opinions. We have all of those things. Ignoring the deaf person, it makes us objects to be fixed. And it dehumanizes us. So you're talking with the interpreter. Who's this other person involved in our conversation? We have the same needs. We need to be saved from a burning building just as anybody else. Are we just an object or a human? So what we really want is to build a relationship within communities, the deaf and hearing community. We don't want people to recognize us as decision makers for us. Hey, asking the interpreter what they think. What do you think about this? It's as if we're not there. It's as if we're not present. And to ask them questions about us just gives us a really bad feeling. So try and remember, the interpreter is a cultural mediator, and they're mediating language. They're helping mediate that language within the relationship. Like right now, the interpreter's speaking for me, to you, but I'm speaking to you through the interpreter. This may be your first experience. Your medical and nursing students, hospital administrators, this may be your first time with an interpreter. This is great. Hopefully it's a positive experience, which means someday, in the future, when you're working, you'll remember this time. And then you'll say, oh, this is no big deal. I can communicate just fine. But having that awkward exchange and ignoring the deaf person is the quickest way to lose the patient and the patient's trust.
I'd like to add, one of the biggest things regarding an interpreter, I will socially talk with my interpreters. For example, if an interpreter is there and a hearing person is next to them and they're talking and I'm talking to, and the hearing person says, don't interpret that, and they cover their mouth as if we don't notice that. It's a common problem. The interpreter will still interpret it, and they say, no, don't interpret that. But the interpreters get it. If you don't want us to know, leave the room. Don't say it in front of my interpreter, because the interpreter is me, is my shadow ears. I need to know what is being said. They're there for me. If I'm not there, they're not there. And really quick, I know you need to move on. For example, when I went to school for massage therapy, there were 2 interpreters. They could have ruined my chance for my having a relationship with my classmates. So what happened when I graduated, I didn't have a peer group. I had no licensed massage therapy community because they never learned, and sadly, the interpreters never helped with that part, that the other masseuses spoke with me. And that's an impact that I can have, and it hurts them personal to not have a personal relationship. You know, it hurts in every area.
I'd like to comment on that. Thank you. I think we're unified in this discussion. The way to connect with people as human beings is really eye contact. So for a deaf person, deaf, blind, low vision, usually it's through touch. And a hearing person's like, whoa, what are they doing? Get out of my body bubble. You're too close to me. You're staring at me. I don't like you you keep looking at me, right? It's like the cat, right? Like, whoa, what are you looking at me? Well, it's interesting. For me, using an interpreter, I have to stare at the interpreter more than the hearing person. And they're like, wait, why aren't you looking at me? Well, I have to hear what you're saying, and I hear with my eyes. I'm looking, and I'm trying to work hard to look at both of you. So for a hearing person, when you communicate with me, yes, you have to look at me. And if I notice something awkward, then sometimes I'll ask the interpreter to stand behind the hearing person. And they're like, no, don't look at them, look at me. So there are these challenges, but we try and educate our hearing friends. And ironically, the hearing people have to, being a communication mediator, it's not just for the deaf person, it's also for the hearing person. So keep that in mind, that interpreters are for both of
Thanks
us.
so much. We actually have a lot more questions about cultural competency, but I'm going to skip over to the community health questions, just in the interest of time. So a few questions, I'm going to see if I can lump them together. What are some health disparities between hearing and deaf people? Also, a question about, are you able to access interventions that cater to hearing people, like suicide, domestic violence, and rape hotlines, or what other resources are available to you if these aren't accessible?
Hello? Yes, okay. I'm going to speak from my perspective as an attorney here, because there are a lot of disparities in terms of the patient-doctor relationship, but there's also a disparity in treatment. And I'll speak about this disparity in treatment because I think it's more important to know that communication is the foundation for how you communicate with your doctor, right? If you can't say, hey, my leg is hurting, or my heart is hurting, how can the doctor treat you? How can the nurse help you, right? So if you're not able to say what's hurting and the doctor can't tell you how to fix that, that's a communication problem, but more importantly, it's a treatment problem. If the doctor doesn't know what's wrong with you, how does he treat you? Right? And that is a health disparity. Now, it has become so severe that in some situations, a person who has not had access to an ASL interpreter in the hospital has died. There was a case of where a man had cancer and didn't know he had cancer because the hospital wouldn't provide him with an ASL interpreter. And the man died. He died not knowing that he had cancer. So that is a huge health disparity, because if the person was not deaf, the doctor would have told him immediately, you have cancer, let's start chemo. So that is a problem. So there's a real disparity in terms of health treatment, but there's also a disparity in terms of communication. Now, the amazingly sad, shocking statistic is that only 17% of signers receive an ASL interpreter in healthcare settings. 17%. That is really low. And that's part of the reason why there's litigation, why we had a protest, is because that number is unacceptable. And we need to change that. And we're hoping to change that by also educating you, those who are studying being interpreters, those who are studying to become nurses or doctors, is that when you get out in the field, you can change that statistic. And if a deaf person comes to you and an administrator says we can't have an interpreter, you as a doctor can override them and say, I need this interpreter for my patient and I need it now. Okay, thank you.
Please.
So, for 12 or 13 years, I've been a CNA and in rehab. Now, for JMS, the School for the Deaf, the beginning of this year, JMS noticed that a lot of kids felt more comfortable going in and telling the nurse's office, because I'm in there to help with communication. None of the nurses previously had communication abilities. They could barely sign. But now the kids come in communication. Now, rehab facilities I've worked at for 6 years, I think I had a total of 3 patients that were deaf. Different timing, of course. Not once did they provide an interpreter for them. They had me sign for them, and I said, wait. it's like having a blind person guide a blind person. How does a blind person drive the car, you know? I was frustrated. My facilities had a few lawsuits because they would not look at me. I had rights as well. It's a huge problem. That was the minimum of problems. You know, they said, no, paper and pencil would work. VRI would work, but that's not a live interpreter. You know, VRI is better than paper and pencil, but, you know, they were saying it's such an expense. They wouldn't provide these things, and I experienced that so much I became frustrated. You know, I needed to advocate for my community and for the rights, as though we were just sitting back, and unfortunately all of the patients became frustrated and then become angry, and then my nurse would say, this person is mad, they're an angry person. And I would have to say, no, they're frustrated. They don't have accessibility. They're not angry, they're frustrated. We need more help in our accessibility in the hospitals. I'll be really quick.
Well, can I just ask for clarification so people know what they're talking about? Can you explain real quickly what a VRI is? Is it accurate? What are some of the problems with it? And then let's continue with this discussion.
Oh, that was part of the protest, so there we go. VRI is Video Remote Interpreter. What the system is you have an interpreter from out of state, not certified or not licensed in the state of Utah, connected on like an iPad, and you watch an interpreter. But the main problems are the Wi-Fi connection is not usually good. With the it's like FaceTime or something like that, okay? So you have pixelation, you're not able to see. The iPads are usually not charged. They had to recharge it twice on my appointment, whereas my life was expiring. A lot of times you can't hear. The doctors, the interpreter on the video iPad cannot hear what the doctors or nurses are saying. And I, as the patient, have the right to hear everything that's going on in the room, but the interpreter can't hear, and so they can't interpret everything. And then the power is running out. So does that help answer that? Did that help answer that, Sarah?
Yes, that was great. Does anybody else have comments about VRI? Specifically, if it's not working very well, why are they being used so much in hospital settings?
Money. It's cheap. That's it. Speed. Oh. And it's faster for them, but that's still questionable. They say it's faster because they don't have to call an interpreter and wait for an interpreter to arrive. They can treat. But on paper, that looks true, but it's not effective communication. So
I think that definitely relates to your question. The health disparities that we face. A lot of health issues within health disparity have to do with lack of access to services. Video remote interpreting, or VRI, you have to remember it's video, so it's 2D, two-dimensional. And ASL is a three-dimensional language. And you can't pan the camera to get the language in a 2D world to be as effective as a 3D language should be. So it's impossible for it to reach its full potential. So sometimes you have to, it's a visual spatial language, and so having 2D is never going to be as effective. Now there are some access issues just in that alone, but as it was mentioned, they look at the cost. And there are rural areas outside in the country where sure, it's quicker, it's easier, it's more accessible to get an interpreter. In the city, definitely you can get interpreters a lot quicker than you can in rural areas. But the availability of interpreters in rural towns of 1,000 people are very few to none. So we do have to think about that. Maybe video remote interpreting, like she said, on paper, it looks good, but is rural internet faster or slower than that in the city? So there's other factors to consider. We really have to consider those things, because even though it may look good on paper, there are a lot of health disparities that it's adding to and not helping. And they've never asked the community for our opinion. They never did. No, they haven't. Yeah, they never asked the community what we need and what we want. They just went ahead and said, oh, here we go. Let's make these decisions for the members of the deaf community, but without us. Back in the 80s, back in the 1980s, there was a protest called Nothing About Us Without Us. It was under the disability community back in the 1980s. And we're still fighting this today. Nothing about us without us. So nothing about deaf people without deaf people. And it should be recognized that these disparities are quite often related to access to services. Access starting with actually accessing is one thing, and then once we get access to the service, then there's a disfluency. We may not understand, we may have access, but we're still not understanding the language. It could be an education issue. So there's a whole monster around that one little issue, but it does start with language acquisition and being able to learn and understand. I do want to add, I'm going to switch to sign language because it's actually easier to explain visually, and I want you to see. One of the problems, like with a CAT scan or an MRI, with VRI, you can't get into that machine and manipulate the machine inside of a CT or MRI. A live interpreter can be there, and they can sign to me like, oh, hold my breath? Okay, all right. But with VRI, you can't do that. So having the iPad in the MRI room, it's metal, right? It's problematic to begin with. Another problem is, and it's very common, they use VRI for giving birth to babies. Once the baby's born, the team of doctors surrounds, and the mom just gave birth, and here's the team, and where's my interpreter? If the mom's using VRI, she has to look. Is that normal? No, it's not, if you don't know. The interpreter can easily move and be agile in the environment. Whereas in VRI, it's not like they're going to have somebody to hold the screen and move it around. Wait, no, hold it to the right. It's impossible. So during pregnancy and giving birth, VRI is not appropriate, let alone effective. My first lawsuit was with parents. The mother gave birth without an interpreter, a live interpreter. They used VRI, and it was hard on her emotionally. This was her first time, and what happened, what was going on, there was no explanation of, the epidural, what do you call that? Yes, thank you, that. We're going to give you this shot. They never said anything. It was just like, whoa, what's going on? What's that? She was in shock, and unfortunately, this happened again 2 years later with the same mom and no interpreter. She was ready to give birth. There was nobody to explain the epidural process. If you can imagine going through that again, she's very traumatized with the hospital because there was nobody there to communicate with her and to explain what was going on. It was very frustrating and very sad and unfair for the mother who needed medical service in order to successfully give birth to her baby. We have a beautiful experience too after Michael. A friend of mine went to celebrate the birth of a baby of a deaf woman and a deaf father. They asked me to stay in the room, while they were, teaching the lactation, the lactation training and education. And the nurse didn't know how to communicate. They never called an interpreter. And I said, well, you have rights, you have rights to ask. So they asked and they tried to write, but they never did, and that's fine. There's your health disparity. But what it turned into, without an interpreter showing up, instead, the nurse taught them how to use formula.
No.
And they never taught them how to breastfeed and pump milk. So the deaf mother really wanted to breastfeed, but she was never taught how. She was never taught how to get the baby to latch. And so she just used formula. Now, a lot of that was a barrier of language, which could have been resolved with access to communication. We're not asking you to know sign language. We wouldn't ask for that. But what we are asking you is to close the gap on the disparity, close the gap on those concerns, and that starts with having access to the bigger picture and access to the system, which makes us less disabled, if you will.
So the birth should be a beautiful experience, and in answer to your question with mental health and the disparity, getting access for that, and right in 2015 I had tried to commit suicide. My family took me to LDS Behavioral Service Hospital, and they would not provide an interpreter. And I said, how am I supposed to see value in me if the people trying to save my life will not give me access to learn how? And then, it happened too often. Many deaf people kill themselves because they see no value in themselves, because they cannot get health care therapy or anything. They just gave me pills and said, you're fine, but not the fix that I need. When I went in to get help, and I wanted help, and I struggled and struggled for 5 days without an interpreter. That behavioral hospital is like a prison, by the way. They try to keep you from harming yourself. But I had no understanding. I didn't even have my hearing aids. I had no communication, no understanding. They give me a cup, I take it. I was in a white room by myself, and I'm supposed to somehow get out of the darkness and say, okay, I want to live again. That's impossible. For those that are interested in the mental health field, there is a great disparity of equality, okay?
I'm going to switch back to English. When we're talking about disparities, in terms of medical or mental health, I want to talk about disparity in terms of domestic violence and criminal issues, because oftentimes the police don't want to provide an ASL interpreter if there's some kind of dispute or if there's domestic violence. I've had a situation where the police asked the perpetrator to interpret for the victim. And you can, yep.
And they think it's fine.
Yep. And the police officer think, oh, this is no big deal. But obviously you can see where the problem is. The perpetrator is interpreting for the victim. He's going to edit out or selectively choose what the victim is saying. And that can happen in sexual assault cases where the perpetrator has interpreted for the victim. So it creates a lot of problems from the side of representing the victim, because the police is going to rely on her statement that was given through the interpreter, who's also the perpetrator. Now, that's a problem. And so on the mental health side, when you're dealing with domestic violence or or if you're dealing with rape or those kind of things. That is why an ASL interpreter is there, is to eliminate that conflict of interest so that the perpetrator or the abuser is not interpreting for the victim. And that's really important, and that's why it's important in hospital settings, because oftentimes you will, of those of you in the medical field and the interpreting field, but if you're in the medical field, there will be times when you have a deaf person who's a victim of a crime. And you need to have that ASL interpreter there, because things go really messy fast if the perpetrator is interpreting for the victim. So I hope you keep that in mind. So when you're dealing with a sexual assault victim or a victim of any crime, get the ASL interpreter there. It makes things a lot easier on the prosecution end, so that we can go after the perpetrator.
Thank you. So we had a couple questions about policy. So I was wondering, what are some of the current policies pertaining to providing an interpreter? What policies would you like to see, whether that's federal, state, local, hospital policies, or things like that?
Already have, or what we want?
Yeah, what do you already have, and then what more would you like to see?
Thanks for the clarification.
Can I just start with process? So a couple years ago, Jared reached out to me and said, we're building this new international airport terminal, which is a bazillion-dollar project. Can we look at putting looping in this while we're building a new building? It's better to do that now. There's some thought that maybe later there might be maybe ADA will require looping. It doesn't now, but can we at least go and talk to the people that are investing in this new building, and let's have looping put in. Immediately, they just said, no, we've heard about that, it's too expensive. Well, I didn't know that much about looping, I had to learn about it myself anyway. But no, it's just too expensive. And we went to some city officials, and they said, okay, well, we need to learn a little bit more about that ourselves. We've got a committee that deals with access and disabilities and things like that. So let's get some members of the deaf community to come in and help us understand this issue. It's 3 years later, and we still don't have a meeting. But worse, I hate to tell Jared this, but they already made a decision and said, okay, we've already decided we like this other thing better, and we've already done it, without talking to anyone. Any leaders of the deaf community, anybody that this impacts. And
we're not surprised.
I am so discouraged by that dismissal, that we think we know better over here than the people that are impacted by this policy decision. And on top of that, the airport designers and the airport administration is saying, look, we've saved so much money building this new airport terminal, but at no point did they invite us in, and I've asked for it over and over and over. Please meet with Jared, please meet with, there's a looping association in the state. Please meet with this group so you can understand this technology, so you can understand how it impacts real people that are trying to travel, that are coming, people that are coming through our city and touring our city, our state. And that's been very frustrating to me that that people would make the decision for and in behalf of other people that are impacted. I think that's was a very sad situation. I'm still poking at him though, saying you really need to still meet and still do something about this. But again, this is in the area of advocating for yourselves on policy.
The question? Can you clarify what looping is the question.
I've got to step out for a divorce mediation, but I'll just explain this very quickly. So those of us who wear hearing aids have a little T-coil inside the hearing aid that is able to pick up electromagnetic sources. And that source is embedded in the ground. So if they're constructing a building, they set like a little copper wire, and anybody who's inside that copper wire is then connected to a microphone, and then when the speaker speaks into it, that voice gets traveled around this copper wire, and the hearing aid can then pick it up. So that's a very quick explanation of looping system. It's another way of providing a communication access for somebody who has a hearing loss that wears hearing aids. So there are other technologies like Bluetooth and things like that, but loop systems can be great in hospitals. When I was in England, I got to visit the United Kingdom Supreme Court. That's like the top court in England, and I got to sit in on a argument that they had, a presentation before the Supreme Court. And it was crazy that I could follow everything that they were discussing because of the hearing loop. So they were discussing this arcane British law, and I understood it. And for me, that was like my holy moment, right? And it was, to me, that sold me on the hearing loops thing. So it's helpful for somebody who has a hearing loss that wears hearing aids. Doesn't work for everyone. Those who are deaf and don't wear hearing aids, obviously, it doesn't work. But I have to apologize. I have to step out for a divorce mediation thing. So if you excuse me, thank you. I'll be back, though. I promise. You can't be a bit of warriors forever.
So in regards to the use of technology, why can't deaf use technology? Now, it doesn't work for me, right? It doesn't benefit me. Maybe a little bit for some people, but for me, not. So keep in mind that I'm not trying to oppress, but let people decide based on their own experience what works for them. Now, in regards to new design ideas, or how do we set up or build a better structure, right? The fact is, in different arenas, whether it be education, medical, public service, we have the power to make decisions and policy. For example, I've had a tough experience with the school district. I'm a deaf parent. My wife is deaf. Our children are hearing. And we send them to public school within our local district. And the school has an after-school program or a parent-teacher conference. And I said, hey, I'd like to have an interpreter. And so they used an interpreter, which is an educational interpreter. Now, those interpreters qualify to interpret for deaf children in the school, not deaf adults. And that's a different type of qualification. And I've used education interpreters who just didn't understand what was going on. They were trying to fingerspell everything. They had limited experience within the deaf community. And the school principal said, well, I told the school principal, I can't use your educational interpreter. We are bilingual. They can't understand our fingerspelling. They can't read our facial expressions. They're using the wrong signs. And the teacher's becoming frustrated with us because there's obviously a communication gap. So how's our children doing in school? How are they doing in class? And we went back and forth, and it was a saga. Went on for ages. And so we moved up the ladder up to the State Office of Education, and they referred us back to the school district. And I'm like, we've already been there and done that. We've asked for a qualified interpreter. Just make a contract. So I was ready to sue. And there was a group of us who got together, and their attorney thought they were the experts in interpreting law. And, they were ready to go back and forth. We had sent letters back and forth, and they refused to meet with us. They had made their decision. I think that the discussion was accessibility and what's reasonable as a reasonable accommodation. And, like at the airport, what we did was we put in a loop system, and that technology just, satisfies the requirement of the law. Well, but that's not a reasonable accommodation for me. That's baloney. You have to ask me if that's reasonable. I'm the expert on me. And so the school district administration said, we provide an interpreter. Well, but this didn't work. And then you did this and it didn't work. So we didn't have access to our children and their education. we are their parents, and we have rights, as other parents do, to have access to teachers in their educational program. That's what's fair. That's what the law is for. We got to the point to where we had to bring in a lawyer who's an expert in interpreting laws and convince the district and their lawyers. They realized, oh, okay, we shouldn't use an educational interpreter. We should use a professional agency, contract with them to provide for our needs. And after that, things were much better. But if they would have listened to us in the first place, things would have gone a lot smoother. Oh, but we have budgetary issues. Listen, in the long run, everybody's going to be happier in the end, right? In the end, everybody will just be happier. Work with us, meet with us. We'll work this out. It's worth putting it in your budget. That's just something for you to keep in mind, that there's an ongoing struggle with what's reasonable. Thank you. This is a good discussion, and I've got a lot to think about based on the question, which was, what policies or laws or codes do we currently have? Well, we have ADA, Americans with Disabilities Act. We have 504 and others that are related to accessibility and providing interpreting. We can definitely improve on the enforcement of these laws. Now, the laws are there. We have them. But there's not enough of a voice in the deaf community trying to make sure that we get those. And there is very little, if any, enforcement. Whether or not it was intended to be there, there is very little enforcement. So this is a very good question. The second part that I'm thinking about is, what do we need to add? Well, again, I'm thinking about language and language acquisition. There are a lot of protections. As a deaf adult, we have a lot of protections, but deaf children might not necessarily have that. A lot of deaf children have parents who don't sign. Their parents are hearing, they don't know the language, and so they don't have language. And so when they go to a doctor's appointment for their deaf child and they're a hearing person who has no idea why they're there, there's no support, there's no advocacy for their child. The parents and the doctor talks, and I remember as a little child just kind of watching them talk, and they're going back and forth, and what's wrong with me? What are you talking about? Later I realized there was nothing wrong with me. It was just I had no access to adult communication. Now, hearing children have access to adult hearing communication, right? We call it incidental learning, right? Incidental learning is where, it's on the periphery. It's on the deaf children don't necessarily hear all those things that they can later learn. So hearing children, they're in doctor's offices and in the home, and they have access to that. As a deaf child, typically they don't have that incidental language. And to add to that, who is fighting for the deaf children? The parents are doing all they can with the knowledge they have, which is great. Thank you, parents. But hospitals and doctors' offices, are they really doing what they can? They're getting money from those parents. Sorry, that's the reality. So, how are we going to support and give a voice to those children who don't know why they're there in the first place? It's crucial, absolutely crucial, that we give advocacy for their esteem, that while they're growing up, like was mentioned, mental health issues, psychological issues, emotional issues, spiritual growth, physical growth, all of that creates a whole person. And I think that that's something that we can add. And can I add to that quickly? As a deaf mentor, oftentimes I work with families who the parents will ask, okay, I have a doctor's appointment for my child, should I bring an interpreter? And I always say yes. Whether the child understands or not, they have the right to an interpreter, first of all. Secondly, they may not know what's going on, but they're visually picking up on that incidental language. They're getting access to communication. Maybe they're going to start asking more questions so they can be involved. some families, as young as 2 years old, when they go to the hospital, they have an interpreter. Sometimes the doctor will say, this is ridiculous, we don't need it, they don't understand. No, I tell the parents, you need to advocate and say, this is my child, they have the right to have a voice and to hear a voice. And so you're right, I would definitely advocate for that. We really need to start advocating for the children.
Okay, I just want to ask, yeah. That's a good one. Okay, so I just want to ask 2 more questions and then open it up to questions from the audience. I know that some of our panelists need to head out in a few minutes, so that's fine. Whoever can stay, can stay. But I want to ask a question concerning the death tax. Oh, thank you. Particularly things like smoke alarms, carbon monoxide alarms, kind of those community help type of things that may not be as accessible.
Where do I begin?
Get ready. It's on a soapbox.
Yes, I am on my soapbox. So the death tax, if I can just kind of compare it, I don't know if this is a fair comparison, but you know, like pink tax. You heard of the pink tax? Men's razors and shavers and female razors and shavers. I mean, there's a color difference, right? But the pink one costs more. Is that, I don't know, I mean, okay, so now let's look at the deaf community. An alarm, just any alarm to wake you up. You wake up and the alarm goes off, or the alarm goes off after you wake up. Okay, hearing or deaf, this is a hearing perspective. So you hearing people, how many people think it, my alarm cost me $125. Yeah, and you don't have to buy it just once. Yeah, you have to buy it every couple of years. It breaks down quicker. It's not like a lifetime warranty, and it's so expensive to, you just have to replace it, right? The Walmart alarms, you pay $5 and you get a new one, right? I gotta pay $125 just for my alarm to switch it out. It's expensive. We call that death tax, okay? Now, let me take the other perspective of death tax. In the job, in the workplace. Insurance, most of us receive health insurance through our employer. And in theory, theoretically, some work through the state and you get your insurance through, you know, the theory is that we get benefits through our employer. Right now, deaf people, their numbers are terrible, and I'm not going to share numbers with you right now because I feel like there's a lot of negativity that's been presented, but I really want to be encouraging and hopeful. But the reality is, there's huge unemployment in the deaf community and underemployment in the deaf community, where they have part-time work or multiple part-time works because they're not eligible or they don't have access to insurance through their work, which means they not only don't have access, but they have to pay more for the ability to receive services and to meet their needs. So the death tax is that you have to work harder, sometimes 3, 4, 5 times harder to get similar benefits that hearing people have. Whether it be through your employer, through language, communication, purchasing, you know, simple things, smoke alarms, you know, you have to put lights up instead of audible alarm. My home, honestly, I don't have alarms. I don't have smoke alarms. I do have them for my hearing family. My kids can hear, but for me, I don't have access to the alarms. I can't hear them. So I have to rely on other things, you know, or communication. You know, if I'm home alone, my family's on vacation, which can happen quite often. During my PhD, I was staying home and had to focus. I couldn't hear the alarms. I could smell and I have other senses, but what if I was asleep? Unfortunately, I was just out of luck, and I'm not going to say the you know what out of luck, but I was out of luck. So that means again, it comes down to access, and deaf tax is a vital concept that we need to discuss in order to understand the disparities and to equalize them. We need to get rid of the death tax in order to have a positive effect.
Thank you. So we are rapidly running out of time. I have one more question for you, and then I have one from the audience. If anybody else in the audience has a question, go ahead and pass it to the middle right now, and Rachel can come bring it to the front. But my last question is, what solutions do you think would alleviate some of the health disparities, or what solutions would make sure deaf individuals have more equitable access to health information and services?
Provide a live interpreter. And what that looks like is, if somebody has Spanish as their first language, they bring in an interpreter right away. There's no question. They don't even ask. If it's a deaf person, no. Just provide a live interpreter. It's okay to use VRI until a live interpreter can show up. We in the deaf community are okay with that. We're not okay if we ask and are denied. That's taking my rights. Please provide live interpreters, period. I want to thank you all and Legislator Coleman for taking this first step, right? I applaud you all for this first step. This is huge. Thank you. Look at us as humans. We're people. We live, we breathe, we bleed. We have opinions, we have thoughts. So see us as human. And that is a big, valuable step. And like was said, I don't know if you have to look at budgets or costs. I understand that, but that's not my field of expertise. But what I do understand is hiring a full-time interpreter at a hospital, that becomes their job. And maybe they might be busy, and maybe there'll be times where it's a slow day. But that's just like nurses and doctors in a hospital, right? Sometimes they're really busy, and sometimes it's a slow day. So bringing in a live interpreter is definitely one of the solutions that you have, having a live interpreter on staff, or one that'll do within a region, have it on call, within a certain radius. That can definitely help a lot of issues to have an interpreter just go from facility to facility. And if I can add to that, deaf people who ask for an interpreter are just trying to communicate. They're not ignoring the situation. They just want to communicate. So don't ignore what we're asking for. We're not looking to sue people. We're not looking to check out your budget. We just want to partner with you and communicate. We want the same access and rights and feel that we are human as well, and that we can associate and have access to the world. It's not like, oh, well, don't you bring an interpreter with you? Oh, we have somebody who learned sign language in high school. That doesn't work. We are more than halfway to the communication. You need to come halfway.
So much. Okay, I have 2 student questions. I'll just read both of them, and you can answer whichever one you want, or both. So the first one says, what experiences have you had in dental offices that you wish were different? Probably from a dental hygiene student we have here. And what advice would you give dental professionals when treating deaf patients? The second one is, how can we as UVU students be an asset and an ally to the deaf community?
I'm going to answer the last one, and then I have to run. I have a few ASL interpreters that I need to massage, and they're waiting for me. Lucky them, huh? Hook up with me later if you want one. Anyway, I have a page called Utah Deaf hospital rights. Is that right? I don't know. I'm looking at my partner. So please go there and follow us, like us. I'm trying to get a committee of people who have a passion to make these changes. So far, it's pretty much me. I'm the lone voice, and I need more voices. I think having your voices here and partnering with us is huge. You can help explain to us in the deaf community how we can help you help us. And I am desperate for your help and your support. Any way that you can, please go to the webpage, go to the Facebook page, follow us. You know, it's a holiday. Enjoy a couple of months, but once January comes, get ready to work and let's go. The more people we have involved, even 5 minutes a week, if more people get involved, the better. So please, I'm begging you. Okay, agreed? Thank you. I have to go. I love you all. Thank you so much. Thank you for the opportunity. Somebody needs a drink. Hello. Can you get? You need. Thank you. Oh, you left your drink. Oh. Thank you so much. Sorry. No, you're good. Congratulations. Thank you. So, how do we reduce this disparity? I'm going to give you 2 suggestions. In health professions in general, recruit deaf and hard of hearing students into your program. I mean, we have the more deaf nurses we have like her, the more deaf doctors we have. Bring them into the program. Quite often they say, oh, you can't hear, you won't be able to communicate with patients. We'll find a way. We are experts. We have dealt with this. We are navigators. We're world navigators. We've learned to navigate our world, whether it's through interpreters or gesturing. We're strategists based on our experience. So recruit deaf and hard of hearing students into your program. Take an active role to do that. Secondly, deaf-owned business. Janelle is within the deaf ecosystem and the deaf economy. If you know of deaf-owned businesses, support them so that they can grow and flourish. Now, related to the current question at hand, what was the last question again?
The question was, how can we as UVU students be an asset and an ally to the deaf community?
And dental, right. Oh yeah. There are actually deaf dentists in other states. My experience growing up, my parents would come in and interpret for me. My mother is a CODA, she's a child of deaf adults, and so she would interpret for me most of my life. Now, as an adult myself, I would ask for an interpreter, oh, we don't have enough time, and excuses. There are many deaf who need interpreters, but they're just tired of fighting, and so they'll just get by and barely make it with whatever they can. But now they have like a new surgical mask that they can see through, and some deaf people can lip read. I mean, that's, until an interpreter can come, or a dentist will try and figure out how to gesture, just make the best out of the situation. But how UVU students can, how many of you are my students? Where's my students? You guys, you're an example. Take ASL classes, learn sign language, learn deaf culture. That's just one example of how you can partner with us. Take ASL classes, learn. That's what you can do to be involved. Now, another concern is that there's the deaf community and there's a hearing person, right? There's going to be a little resistance like, okay, who are you and why are you here? And this is with any marginalized community. Someone comes in and it's like, wait, who are you? There's going to be expect some resistance. Well, I'm trying to learn ASL and I want to be able to communicate. They might put their guard down a little bit to communicate with you. I'm here to help you. I'm here to fix you. I'm here to get a job. That resistance is going to come back up. So keep that in mind. But the bottom line is, learn the language, learn the culture, like Kim Coleman, she's here with the deaf. She has a relationship within the deaf community, and she's building that bridge of trust. So those are my thoughts. I want to address the question. As a patient in the dentist, when they were sticking me with a needle, I had all kinds of paranoia. They're like, oh, no, it's not a needle. Now when I go to the dentist, I'm like, okay, what are you going to do? Step by step, I want to know exactly what you're doing to prepare, because I'm just traumatized. Now they have deaf glasses, right? You've heard of those? Yeah, it's a deaf-owned business too. Yes, it is a deaf-owned business. So one of my good friends, he's trying to market his business, especially for dentists, because it's huge. And what they do is when you wear glasses, there's a sign language interpreter. So when you're laying down, it's actually embedded in the glasses frame. And you don't have to use, it doesn't matter about the mask. It's amazing. I want my dentist to have that technology. Not everybody has it. It's very expensive. It's definitely worth it. And then how can the students help? Yes, how you can advocate and partner with us. Oh, I forgot what I was going to say. I just lost my train of thought. Deaf-owned business, working, employment. I sent a message to my boss saying, look, there's no room for growth. I've been working here for 5 years. I want to be promoted. I felt like I've been oppressed and kept down. I feel like I'm working 3 times harder than most of my hearing colleagues, and I would come and figure out what's going on, and I'm doing more, and I was born for this job, but it's frustrating. So I just wanted to mention that a lot of deaf people don't work in certain places because they feel like their work is valued. If you want to hire or work with deaf people, recognize them for their work. Encourage them more. Be a positive influence to encourage them and give them room to grow. Give them a chance too, right? They really do want to work.
Okay, thank you for coming. We are just out of time, sadly. I'd love to keep talking about this, but we only have the room till 2:30. So thank you guys so much. I think we all learned a ton from you. Can we give them all a big hand? Thank you so much. And thank you all for coming. Thanks for taking, I know it's super busy with finals just around the corner, but thank you all for coming and taking time out of your busy schedules to come hear more about this.